Welcome to another exciting episode of In-Depth Eye Health podcast series brought to you by iFocus and iHub Nigeria Initiative. The series provide incredible insight into topical eye health issues and also serve as a platform for continuous professional development for eye care workers. Thank you as you listen. Yes.
Hi everyone, I'm Dr. Mustafa Baturi from iFocus, a platform for advancing eye health through shared learning. Welcome to another episode of our podcast series. In this episode, we'll be discussing the COVID-19 pandemic in Nigeria, prevention, management, and the way forward.
Hi everyone, I'm Dr. Ifeanyi from iHub Nigeria, an eye health awareness initiative. Our guest today is Dr. Oteri Okolo, an ophthalmologist and the National Eye Care Program Coordinator at the Federal Ministry of Health. Thank you for joining us, Dr. Okolo.
Thank you for having me.
We are currently in the middle of a pandemic, which is practically changing lives. What exactly is COVID-19?
COVID-19 is a very infectious disease caused by the coronavirus. The coronavirus is a novel or new strain of the SARS-CoV-2 virus. It was first detected in December in a city known as Wuhan in China. So basically, that's just a brief definition of what it is. It basically causes a respiratory condition, a pneumonia, but there are all other symptoms which I think we'll talk about later. So basically, that's what COVID-19 is.
Okay, so what public health measures are currently in place to curb this pandemic, and why are they necessary at this time?
Okay. Now, I'll first talk about the necessity of the public health interventions. Like we all know, COVID-19 is a very infectious disease. So, it's already a pandemic, so it has implications for public health, for other aspects of the way we live. Because it's very infectious, we definitely need public health interventions to halt the spread. Now, just goes quickly to the interventions. Now, it's basically a droplet infection. That means that these droplets carry the virus, and then if another person gets in contact with these droplets and probably puts it on their eyes or the nose or the mouth, that person can get infected with this virus. Now, how these droplets are generated from speaking, from coughing or sneezing. So now it's important that we wash our hands regularly for at least 20 seconds. Now I'm talking about our personal protection now, with soap or water or an alcohol-based hand rub that at least has about 70% alcohol. If you cough, please cover your nose or your mouth, either with a disposable tissue or into your bent or flexed elbow. Now, also, it's important to ensure that we observe social distancing, because when someone coughs and generates aerosols, like we said, these droplets carry the virus. So if you can keep at least a distance of about 2 meters with people, especially those who you recognize are well, that will also protect us. And basically, for now, for Nigeria, we're instituting lockdown in 3 states: FCT, the FCT Abuja, Lagos, and Ogun State. So basically, that will help. It has been noticed even in other countries that staying at home prevents the spread of this disease, since it's very infectious from one person to another. Now, those are the personal things that we need to do. As a country, we have had various interventions, initially screening at the airports, and then finally we had to close down our land and sea borders, and ensure that we don't have people coming in without the notice of the government. Like we said, it's a pandemic, so basically it was imported into the country. So basically, I think generally the specific public health interventions that should be of interest to us are the ones I have already mentioned.
Yeah, that's quite tremendous. What happens when people get infected with COVID-19?
Okay, like I said before, basically, the important symptoms of COVID-19, is majorly a respiratory condition. So you find that people come down with cough, said to be a dry cough. People have fever, especially very high fevers. They usually feel tired with body pains, and they feel generally ill. And as the disease progresses, they could develop difficulty in breathing. Now, there are other symptoms that are not related to the respiratory system, which I think people should also know about. Like you could have people coming in with diarrhea, people coming in with red eyes. But basically, the fever and the cough, tiredness, and sore throat. Usually, the sore throat usually starts like a scratching sensation in the throat. So generally, those are the symptoms of this disease. Now, for Nigeria, there are some risk factors which we identified early. Like I said before, it's a disease that was imported into Nigeria. So anyone with a history of travel to high burden countries, that's countries with high burden of this infection, and people who have come in contact with those people, those are risk factors for the disease. So I think those are just the major symptoms that everybody should know.
Okay, thank you. What roles do you think different groups of people can play in ensuring that we win this fight against COVID? I mean, like the government, the health workers, the populace. What can we all do individually?
Okay. Now, the fighting COVID to a standstill, which is something Nigeria should do, is a collective responsibility. It involves every citizen, and specifically agencies of government that are responsible for health, and then, of course, the federal government. Now, I'll start with the individual. Basically, our first responsibility is to ensure that we obey the regulations for wherever we are. If we were to stay at home, we should stay at home. Then, of course, observe the social distancing, the respiratory protocols like coughing into your elbow or using a disposable tissue. Ensuring that you wash your hands, especially when you find that you're moving from place to place, or you're coming from outside into your home. Make sure you wash your hands, and especially, and if you have to go to work, make sure you observe normal social distancing. And then, of course, as responsible members of the society, it's also important for us to educate those around us that do not know about this disease. Because you see, the thing with COVID is, if the next person doesn't take responsibility and obeys those protocols, that person also puts you and other people at risk. So if we could also help to educate people about the symptoms of the disease, how it spreads, and the regulations for where we are. Now, for government, I believe the government through the NCDC and the Federal Ministry of Health have been working even before we recorded our index case in Nigeria. Like I mentioned, screening at airports and all of that. They're keeping us up to speed on the number of cases, those who are discharged, and the deaths. They are coordinating the care of the patients, coordinating contact tracing, and all of that. And also monitoring, of course, monitoring our borders to ensure that nobody crosses without their notice, and things like that. So basically, it's a collective responsibility. And for the lockdown, it's of course expected that government provides palliatives to ensure that people who earn a daily wage are able to be at home and have food to eat, so that they are able to comply with the instruction to stay at home. So generally, I think those are the responsibilities of everyone. And like I think I forgot to mention, as part of the public health intervention of government also, when you asked the first time, is to provide information for the populace, and I think they have been doing that. So it's our responsibility to pass on this information to the next man. And I believe that with government and all its MDAs and all citizens in Nigeria, putting our hands together, we'll be able to beat COVID-19.
Thank you so much, Dr. Okolo. I think everyone needs to take responsibility. The message is loud and clear. We appreciate your invaluable insights on COVID-19 in Nigeria, and it has been a real pleasure having you on the program. Thank you so much.
Thank you, Dr.
Thank you
Okolo.
thank you for having me. Thank you.